Thank you, Emilia. So I wanted to, in this next section, share some examples in the medical field, or rather in the health space, that technology has impacted, as well as in other areas. And I'm a big believer in concrete things, so I just wanted to share experiences I've come across. And we'll start with some on the SDG 3, the Sustainable Development Goal around health, good healthcare, quality healthcare for every world citizen, which is the goal. And I'm very, very excited to see that, particularly in education and healthcare, there is amazing solutions starting to happen in the technology field. I'll start with back home here. We have several people at Stanford, particularly a brilliant professor, S.V. Maha, is bringing some of the best Stanford ER medicine practices to places like Inner Mongolia, rural India, and training the trainers kind of to train doctors or even community health providers where there are no doctors in saving large numbers of lives. And it's very, very heartening to see this kind of deep collaboration across people from across the globe. And this is possible because online technology can be used to train people. The other example I wanted to share is ZMQ, the social entrepreneur named Hilmi Qureshi in India. It's a game changer mobile app which is helping young girls kind of have a sense of their own identity, self-confidence, also information about their health that they have no other ways of getting, especially vulnerable girls. And what I love about this app is it is also helping girls who cannot even read and write by using icons and stories, kind of animated stories that they can look at and learn from around social issues that affect girls, such as early child marriage, role models leading to social change, as well as information about health. And by gamifying and using the story and the visual models, this phone app enables the girls to get interested and engage them. And so this is a game changer. Another one I want to touch on is Your Dost. This is another one where, again, in India, mental health is a very taboo area. There is a cultural issue where people just will not go for help on mental health issues. It's such a huge taboo in society. This is where the anonymity that the internet offers has become a huge asset. Richard saying, "Why are your dosts?" She has now created a platform where people can anonymously go to mental health providers where the identity of both the health recipient and provider is anonymous, and yet there is something like an avatar where the same person you're interacting with and building a relationship, and you go back to them again, but the person doesn't know who you really are. So it's a powerful game changer, and so many people are now seeking help. Another one is Akshay Patra in the field of education and health as well. This is an example of the scale of public-private partnerships, which have been a game changer. And this is where this organization is providing midday meals to children in 12 states, 1.6 million midday meals they're providing. And this at very low cost. The game changer here is they have developed this very, very sophisticated technology-based kitchens where at mass scales, robot-like technologies produce at mass scale nutritious food for that region, for the culture, the kind of food that the people would eat, but very nutritious at a very rapid scale in a very clean manner. And they're able to provide at $15, they're able to feed a child for an entire year. Not just that, the child can take a box of food home, which feeds up to 4 more people in the family. So 5 people can eat a meal a day, and often is their only meal at $15. It's a very nutritious meal, and this makes parents send a lot more girls to schools. And they're doing this in partnership with public schools and with the states, which provide part of the funding, and philanthropists match that funding. And this is an extremely powerful model of technology and public-private partnerships. Another one is, this is an integrated solution. It helps achieve nutrition and good health, eliminate hunger, as well as education. And I think the power is in the integrated solutions that are touching on many of the sustainable development goals. They're all linked, and technology is often enabling linked solutions. Another one I want to touch on is healing fields. This is one where women in rural India, where there are no doctors, women have come together in communities, and this social entrepreneur, Mukti Bosco, she brings these women together, and they pool together money to provide a kind of like a health insurance within the community, where they pool the money for medical needs, because when they need to go to the doctor or need medicines, they don't have the money, but now they pool resources. These community women also learn about basic health services and become the health providers for the first line of very primary health care and health education, as well as it provides employment for the local women. So again, a very integrated manner of achieving 3 or 4 sustainable development goals, and community-led. Comes back to the point that one of you in the room made, that the solutions have to come by engagement from the people that are using them. Those are the very best solutions. And again, technology enables these health providers to kind of learn the best practices and bring them. This one, again, talking of collaboration, Mukti Bosco is now working with Professor S.V. Maha, whom I mentioned earlier, and bringing some of the best practices from Stanford and training some of the health providers in rural India. I also wanted to touch on a few solutions in other areas than health, all the way from solutions in rural and tribal communities to solutions in across entire nations, and solutions like some associates talked about, which links nations. One example is Fiji Natswara. This is an example where tribal India, where people are in very remote parts, remote villages, the indigenous communities, they don't speak the language of rural and urban India. They're very isolated and very vulnerable. This is an audio-based solution. They don't have, often they don't even have internet access, but a few people in each village in tribal India have basic phones, not even smartphones. This ex-BBC journalist has designed a solution where a couple of people in a village are trained on basics of reporting. Every day, they just leave a voicemail via audio phone on what's happening in the village. The next day, villagers all over tribal India just dial into a phone number and they listen to these stories. And amazing stories are coming out about what's happening in villages. People learn from each other. Human rights stories are coming out. When local government authorities don't provide services, that's coming out. Mainstream media is translating and picking up these stories, and it's transforming the life of tribal Indians. Another example in the Sahel, another remote region in Africa, is the Changemaker Salon. Often girls in the Sahel are not, the schools are far away from the villages, so after a certain age, the girls are not sent to school. However, the girls are sent to the hair salons, which are quite far from the villages. So a social entrepreneur has brought the schools into the hair salons, and there are people there who talk with the girls about their identity, bring some education, and it's amazing. It's become a movement. So many girls are coming to the salons. They've had to have, now they're hearing about this, they have to have tents outside the salons because the girls want to learn. And socially, society is okay sending them there. And it's a tradition, and so this has become learning hubs. Similarly, I touched briefly on Blue River Technologies, which has transformed agriculture. Computer vision and robotics now enables weeding is automated by these robots. Weeding is one of the hardest work, back-breaking work for farmers. And not just is it now better for the farmers, they can focus on the crop growing and not worry about pulling out the weeds. There's way less use of now herbicides because of this, because it's very targeted in putting the herbicides on the weeds. So it is a huge environmental benefit as well.
We have about 2 minutes to wrap up.
Okay, perfect. So I will then just jump to Kenya. Kenya is looking as a country to leapfrog on healthcare. The UN, the government, as well as looking to work with private sector in Kenya and across the world, they're inviting health service providers, technology providers to come and partner. The head of the UN in Kenya believes that if the Kenyan tiger can leapfrog on providing universal health care, they could help Kenya have very integrated development and then bring that model to all over Africa. And they believe technology can help make this happen. And then I'll just wrap up with this slide where there's many other things happening. Google Oceans is helping create empathy around the oceans by bringing the oceans alive for people like us. And similarly, there are solutions at Stanford, at many other places from within refugee communities, solving STEM education for refugees, where not only are refugees learning about STEM, they're creating STEM solutions. And I think as these people come together with the UN, with students, with human rights centers, with funders of refugee councils, they can do amazing things. And with that, a final call to action to all of you, that let's come together as a global community to collaborate, innovate, leverage technology, but deeply understand the great responsibility we have to society as we use and build technology to achieve all the global goals, the sustainable development goals, including goal 3 around health. And we remain very careful about the negative externalities of technology as we do this. And thank you.
Thank you so much. Well, we had a good day. Food for thought. So is there any burning comments or questions from anyone? Yes, table 5. Yes. Turn your mic on. Push. Sorry.
Okay. All right. Has anybody had significant pushback about changing the existing cultural norms by introducing a lot of this new learning and new sense of independence and autonomy for the women in a lot of these countries? I'm aware of dealing with some groups where the interface with the child or the woman can be met with some pretty extreme responses. And you fear jeopardizing their safety by introducing some new things.
Right.
And so I applaud everything they're doing, and I guess I'm much more fearful than I am brave to be able to offer opportunities to people from different cultures. And how do you overcome that? And what are your signals to know it's safe to maybe go there?
Yeah. Radhika, did you want to comment?
Sure. And this is absolutely, there's pushback when one is challenging deep-seated things like patriarchy, and there is risks and fears. And one way we do this is by looking at, by we I mean the organizations I collaborate with, is we often start on areas like livelihood, that especially in some of the regions where women haven't been on the forefront, because that is a bit different than going and talking about very directly about rights and changing the role of women, versus livelihood is a way of economically empowering women, and yet is less threatening. And then as women become economically empowered, then they can have the courage and one can collectively address issues like patriarchy. And so, I am in a place where I'm fearful, but I also feel we really need courage, because the situation is so dire right now for so many women and other vulnerable communities that it is very important to change and bring that change. I think technology is just one of the levers, the others, but it is that moment for that cultural change. And there is power in the collective, especially from within a community. So here, right in the heart of Silicon Valley, there's been a lot of fear for women to talk about how hard it has been for them to be a woman in a male-dominated industry. And yes, many of the women say they're having backlashes as a speaker, and yet hundreds more are speaking up because they feel that sense of community, and they realize that for that change, to bring that change, we will have to take a stand and speak up. But of course, in some of the rural communities, one has to be more careful because lives are at risk.
Yeah, and I would like to add from my own experience in global health is that sometimes when you come in and go to the grassroots, engage the community leaders and women leaders, sometimes you can get in and they will take you along to be able to include the changes you want to make in a safer way and make it easier for the women to absorb those changes. We can't parachute everything. Sometimes you really have to be patient, slow down a little bit, learn the culture, and then be able to infuse the change gradually into the culture. And you may even extend to the men a little bit because they may be the gatekeepers you need to get in. But that's what it takes to get to who you want. to get to. So those are some of the lessons. Any other comments? Thank you very much. That was a very good one. All right, thank you. Thank you, Radhika. It's been wonderful.
Thank you. Thank you for the opportunity.